From Hamilton Place Strategies in Washington, D.C., this is the HPS Insights podcast.
It's Wednesday, April 22nd, and this is a special edition of the HPS Insights podcast. Tony Fratto, I'm coming to you from the mountains of southwestern Pennsylvania, where I'm holed up, staying away from any of the people carrying the coronavirus in DC or New York. But I have with me today a really, really good friend and doing some incredibly important work, especially right now, my friend Kumar from Devex, and I'm going to give you a chance to explain Devex. But to me, it's one of my favorite destinations on the internet, and all the work that you guys do that's so unique. It's part media platform and part service for the entire development community. I don't think any of us who are involved in international economic development, global health issues, food, hunger, the cross-border issues where countries are trying to elevate their standards of living. I don't know what we would do without Devex. It's really it's a terrific source of information and service for people. But we wanted to have Raj in today to talk about how COVID-19 is impacting the less developed economies out there in the world, and so Raj, why don't you tell us a little bit, get a little bit more depth on Devex, and then let's dive into what I think is a pretty significant crisis that we're going to be seeing over the next couple of years.
Yeah, let's do that. And it's really good to be with you, Tony. I am here in downtown DC. We're still here for some crazy reason. Coming to you from my kitchen and trying to figure out what our next moves are as a family, because sure, it looks like this is going to keep going for a while. And obviously that has big implications for everybody. And so much of the conversation has been what those implications are in places like Washington, D.C. or New York, for good reason. But what we've been trying to do at Devex is figure out what are the implications in the rest of the world, especially in the lowest income places and the most marginalized communities. What is that going to mean? And I've been spending probably the last, every day feels like a year during this thing, but the last several weeks now, I guess, just on the phone every day with leading epidemiologists, people who work at the major development agencies, the big banks like the World Bank, the big foundations and others, just trying to figure out what are people thinking, how do they see things going, recording a lot of conversations just like this one. So I'd love to talk more about that, because I actually agree with you. I don't think there's enough attention right now on it. And I think it's gonna come back, in a few weeks, maybe we'll start to hear a lot more about what this means in the developing world. But as you said, Devex, basically this is what we cover. We if you work at the World Bank or the Gates Foundation or Save the Children or the UNICEF, probably when you get up in the morning, what you read is Devex. We got reporters and analysts just all over the world writing about these issues, climate and hunger and health, and really trying to focus on the professionals who do that work and give them the kind of information and reporting they need to do it better. And that's really our mission. We started as a student project 20 years ago at Harvard's government school. Amazing. It's been a labor of love. We are about 130 people around the world now who do this work. And our community is a little over 1 million professionals, global development professionals, aid workers, a lot of folks who are right now on the front lines of this crisis. So great to get a chance to talk that through with you a bit today, Tony.
Absolutely. Well, you identified the problem about it not getting enough information is one of the reasons why we wanted to talk about it. I know that I've been focused on the domestic problem quite a bit, right? Because it's obviously we here in the United States are living with it. We're doing things like trying to figure out where to live, how to work, what the cost is going to be, how to help people here who are in need. And of course we should do that. That's where we are and where we live. And the thing that I've been worrying about as someone who's involved in development and health issues is that knowing a few things. One is that the countries that we're talking about, the poorest countries in the world, they do not have the infrastructure to deal with health challenges the way we do. They don't have the hospital networks. They don't have the numbers of doctors. They don't have the amount of, we didn't have the amount of, personal protective equipment that we needed. We didn't have the number of ventilators that we needed. And, I saw a number yesterday that across the entire continent of Africa, there are about 2,000 ventilators, just completely inadequate. Even if they had more ventilators, they wouldn't have the number of and trained people to actually operate the number of ventilators that they're going to need. So that's one, is just the infrastructure. Second is the means to go out and buy the things that you need at a time when we are in a global sudden stop in the economy, where everything has stopped, and they're not like the United States. You can go out and we literally conjured up out of thin air trillions of dollars, because we can borrow in our own money. The money didn't exist before. We put out a call and said we want to borrow it, and we invent it. And so we've got we've got all the trillions of dollars that we could use, and poor countries especially can't do that, especially borrowing in their own currency. And then third is, and it's something I think that that it will be very important for you and Devex, and I know you'll be doing this, is that we know in rich countries already there is an exhaustion with dealing with coronavirus, and we're only who knows which inning we're in, but we're still in the early innings of dealing with it. Even if you've peaked, you're still in the early innings of dealing with the fallout of this, which is going to happen for a very, very long time. There is an exhaustion in rich countries, and there's going to be a relief at going on to the next phase. But the next phase is going to be the part that's hitting, most of the developing world. And I worry that our attention at that point is not going to be there. We're going to be too busy with trying to get back to normal lives here to think about what else is happening in the rest of the world.
Yeah, I think those are all the right risks to pinpoint. And obviously there's a certain amount of uncertainty and everything, but let's just imagine what could come down the road here. I mean, it seems to me likely that when you look at the map of the world, you look at where cases are, most of the cases are in advanced economies, places that have a lot of travel, a lot of connection. There are pretty small numbers. Democratic Republic of Congo, I was just reading on Devex, I think it's 300 cases. I was on the phone with the former health minister of Rwanda a couple of days ago telling me there's just 200 cases in Rwanda. But, that's based on the testing they have available and, relatively small initial numbers. But we've got something on our COVID-19 page on Devex, a little chart, like a timeline that shows you how the cases grew. And it's just a great reminder because you see the United States there with, a couple hundred cases and a couple thousand, and then just suddenly explodes. I mean, it's just a few days and suddenly the numbers absolutely escalate. So chances are we're going to see that. We're going to see this outbreak turn into something much bigger in many countries of the world that, as you say, are pretty ill prepared for it. And the implications there are different because, here you can say, hey, let's social distance. And most people do have a home where they can social distance with their family. In other places, it can be very tough. You live in a slum to really even get the kind of distance from others that you would need. Mm-hmm. And you may not have basic sanitation, toilets and running water to do the hand washing that everybody was telling everybody to do. And then probably your job, many of the countries we're talking about, the lowest income countries, upwards of 80% of the population has a job in the informal sector, quote unquote. Right. Which basically means you have a job where you go out and work every day. You don't have an employer. You go out and you sell something on the streets, and you get cash. You work every day for what you need to eat that day, and so you can't really just stay home for days on end. I mean, there have been images in India of policemen delivering food to people, and in Turkey and other places. They're trying to find a way to do this, but social distancing is very tough to do in a lot of these circumstances. Certainly very tough to do for a long period. So, it's happening to a large degree all over the world, even in the poorest places, but it's not going to be easy to sustain it, and it's going to be expensive to do it. And so you could imagine this, you see this real uptick in the caseload in a lot of the countries with the least resources, right when things are getting better for us here in the US, when things are getting better in Europe, right? But what a lot of the experts say is we're going to see a second wave in the US. And the question is, and I think we're learning this now, the whole point of the word pandemic, this is a global phenomenon. And it can come from Wuhan, China. It can spread to northern Italy. It can come from anywhere. And so certainly certain people might think, well, you just put up borders and walls and you stop all trade and travel or something. But realistically, this is one small planet. People are going to be moving around. We are only as strong as the weakest health system in the world today. And a lot of those weak health systems are in places like sub-Saharan Africa. And this is the moment to think, what do we do to strengthen those health systems? It's actually relatively cheap. You can, in a relatively easy way, put up the systems that we need to really mitigate the disaster that could be coming, to make sure there's less social disruption, political upheaval. And if we don't do all that, we are going to be facing those consequences, and they will absolutely affect us right here back in the United States.
Yeah, I don't think there's any question about that. I mean, I know that the World Bank Group and others are trying to step up with financing. They've tried to do some things to deliver support. I think the number I saw with the World Bank Group is $160 billion roughly. They're going to try to push out over the next 15 months or so.
That's true, but that's basically their normal activities, right? So that's what they're doing. They have a special response fund of $14 billion. It's not nothing, but this is the World Bank doing what they do anyway, and then trying to organize it more strategically for the response. But what we haven't seen is like a new significant investment on top of that.
And that's kind of wanted to get at. I mean, because we think about those numbers, and the numbers we talk about in the United States. I'm not saying we ought not spend them. We should spend all of it and more. But we have. By comparison, for example, we gave the HHS, Department of Health and Human Services, about $100 billion in the phase 1 bill. That came on top of some other health spending that we had in a couple earlier bills, but $100 billion without even a plan on how to spend it. And we've only dispersed about $30 billion of it, and have just, appropriated another $150 billion that will go to health systems, right? So that's in, really a couple weeks of just, hundreds of billions of dollars that we don't really even have a plan on how to spend it here. And if you think about the amounts we're talking about for the developing world, I think since the beginning of PEPFAR in 2005, I think we've spent about $100 billion on PEPFAR. That's like over 15 years of the program. Like, the numbers are not close in terms of the magnitudes are not close. I suspect we need an additional few $100 billion in a very short order to make sure that we're doing the things that we could do to minimize loss of life and to help strengthen those the health infrastructure that's needed in those countries.
And as you said, we're in this very fortunate position in the United States. We've got the world's reserve currency. We can print money, and we can try to fill the holes that appear in our economy through a crisis like this. Most other countries can't do it. You think of that HHS money you're talking about. Why did they put out $100 billion? I think a lot of it's for hospitals.
Yeah.
And the thinking is, okay, you might have one hospital, one city that's in really good shape, but you don't want a hospital in the next state to go bankrupt, or in the next community to go, because this is one country. And so you don't want patients having to drive across state line. You don't want the chaos and the human suffering that causes. The same thing applies outside of our borders.
Yeah.
We don't want our neighboring countries to not have the health systems they need for sick people to get to the hospital. So, I had Mark Dybel, who used to run PEPFAR. He served with you in the George W. Bush administration. He helped create it. Mm-hmm. He then went on and ran the Global Fund, which is the same concept of helping patients, AIDS patients and others, TB, malaria, all over the world. And so he's got an interesting perspective. And I asked him to put a number on it, and he said $30 billion is what we need for primary health. So whether it's 30 billion, which seems low to me too, or a few $100 billion, the point is this is kind of a rounding error in a crisis where the annual spend on foreign aid is $130, $140 billion a year from all the rich countries in the world. Yeah. So in a crisis like this, couldn't we get the rich countries to say, let's double that in 1 year? Let's do a stimulus style bill, knowing that if we don't do it, then the consequences are really direct. It's not just humanitarian. It's not just doing the right thing. We will feel that pain back in our own shores. It seems like the moment, and yet we don't seem to have a lot of leadership around this. We're not hearing these clear voices, I think, on this issue.
We just had the, sort of remote, I guess, or virtual IMF World Bank spring meetings. We would have been having the spring meetings in Washington, D.C. Last week, where the, World Bank Group and IMF and G7, G20 meetings ministers and central bank governors get together and talk about development and these issues. It was done virtually. I mean, I've been banging on this drum too, that, like the biggest thing that we need is international cross-border collaboration, cooperation, directing of resources, sharing of information, collaboration on therapeutics and vaccines, and all the things that we need to be doing it together, and we're not seeing it at all, unfortunately.
We're really not. I mean, what the world has come together for, and I'm talking about the Western world mainly here, but you had the G20 countries who announced during the IMF World Bank Spring meetings, they're going to do suspension of debt payments. And that's a good step. It's a $20 billion assistance package, basically, which means if you were one of the world's poor countries, you qualify for, International Development Association loans from the World Bank, concessional loans from the World Bank. You don't have to pay back to the G20 countries for 6 months. It's worth $20 billion. That's great. But the debt isn't gone. You still have to pay that money, and you pay with interest. You got to pay it later. So I think what we're doing now are kind of the easy things to do, and it's good that we're doing that. But we haven't yet heard the really big, bold plan. And every crisis like this is an opportunity, too, to think about the fact that all the experts, Tony Fauci and others, say, this is not the last pandemic. We're going to see pandemics. So wouldn't we want to strengthen the public health system everywhere in the world to try to see it get to some minimum level? This is an opportunity to do it.
Yeah, it's a great point. I mean, it's a point you made earlier, too, right? I mean, viruses don't know borders. One of the things we may pull out of this is an understanding of just how important it is to have strong health systems, have strong protocols, have strong infrastructure everywhere, because it's in our own best interest. I mean, if we decide that we're going to take care of ourselves and everyone else is on their own, then we actually have no choice but to isolate ourselves even more, right? If we say that you guys are on your own and the virus can spread out there, just don't bring it here. We can't even let people go out there and come back anymore either. Right? This should be in stark relief for all of us right now of just how absurd that sounds, that we can go on for very long period of time, essentially closing off the United States from outsiders. And we're not going to test everybody who gets off an airplane. That's not going to happen. As you said, we don't know what the next virus is. So thinking about ways to keep all places doing the best things they can do to limit and prevent the spread of any kind of disease is just so critical for us. It is in our self-interest.
Yeah, and there's so much we can do about. I had a kind of a virtual coffee conversation, because you can't do these things in person anymore, with 5 global health technology leaders a couple days ago. And these are entrepreneurs who started incredible technology companies that are designed to help the poorest people in the world with global health issues. And the tech has gotten to a point, we don't need to remake the U.S. health system in a developing country. We don't need to do that. It's not as though we're asking the American taxpayer to sort of foot the bill on our dysfunctional giant healthcare system somewhere else. There are really inexpensive, really high-tech models where community health workers, or people who live in the community, get paid sometimes nothing. I mean, just frankly, it's kind of sad. They're often volunteers, but could be paid relatively small wages by their government to go in with a handheld device, a smartphone, with some machine learning algorithms that help with diagnosis, some diagnostic tools. You can get primary care right to the village level, right to the front line. You can use different sensors to test to make sure that vaccines and other medicines are kept cold during throughout the cold chain, the supply chain. There's technology now. One of the entrepreneurs has developed a fingerprint or palm print or face print technology for biometric identification, so you're only giving the medicine once to the right person. All this stuff has been advanced to the point where we don't need an insane stimulus package that's got to be at the US level, but a relatively modest amount of money could really build stronger health systems all over the world in a new way that would protect us and protect people all over.
We're talking to Raj Kumar from Devex. Just a wonderful opportunity to talk about what's happening in the rest of outside of the developed economies, which are dealing with this COVID virus right now. I'm going to take a break and come back, and Raj thinking about the future a little bit, and what might be coming next, and how we get out of this.
Every Friday, Hamilton Place Strategies founding partner Tony Fratto joins John Fagan and Brendan Walsh of Markets Policy Partners for the HPS Macrocast, an in-depth look at the macroeconomic news driving the week. Check out the latest episode at hamiltonplacestrategies.com/podcast.
We're back on HPS Insight. Raj Kumar from Devex. Raj, so we have like these sort of twin storms, we have the fall off in demand globally, broken supply chains from a lot of countries because we can't go out and spend and buy things in developed economies right now. We also have this really, if it wasn't for the pandemic, we'd be talking about what's going on in oil all the time, right? And this dramatic, obviously the fall off in demand, but really, countries unwilling to stop supplying oil when we have no demand. It's one thing for the United States, Russia, Saudi, the world's largest producers, to deal with this problem. They're like the elephants, but a lot of people are getting injured in this right now. And we have a lot of developing countries that are highly dependent on a lot of commodities. A lot of them are highly dependent on oil. How are some of the countries, and which are the ones that you're paying most attention to that are most impacted by, maybe we're giving away oil now. Maybe, oil's almost free.
It was crazy to watch those charts of the May futures contracts drop to negative territory, right? I mean, people will pay you to take their oil. It's just unreal.
It's for a tanker.
Right. The developing world, obviously, it's a lot of different countries. Sub-Saharan Africa is 54 countries. You've got a lot of diversity. But some of the big ones, Nigeria, Angola, they'd be high on the list for major oil exporters. Venezuela, obviously, is in a state of total humanitarian crisis, and the oil price does matter for them. But there's probably more developing countries that are importers when it comes to specifically to oil. And so in many ways, this is an opportunity for those countries. And the question is, will they grab it? And they've all for years been told by the economists, the IMF, and the World Bank, the smart thing to do is use these massive drops in oil prices as a chance to cut your oil subsidies. Because in a lot of places, there are subsidies for gasoline purchases.
Right.
And so here's an opportunity. You can cut those subsidies because the prices are coming down anyway on their own. So the consumer doesn't feel it. Demand is so low in a lot of these places with the shutdown. And then use those government dollars for other things, like healthcare, like education. So in many ways, the oil specifically could create a really big opportunity for countries. It may delay the move to renewable energies in some of those oil importers, but it could create a big opportunity. But certainly for exporters like Nigeria, Angola, Venezuela, Iran, this is existential. Iraq, this is a big issue. I would say you made the point about commodity exporters in general. While not every developing country is an oil exporter, in general, the big part of their economy tends to be based on raw commodity export of all kinds, agricultural products and minerals, and also they're very dependent on tourism and travel. So in general, it's hard to generalize across so many countries, but in general, these lower income countries are going to be hit really hard. They can't just go work from home, the way we can when you need to be operating mines and fields and you need cargo ships. So the drops in demand and this move to say, hey, look, manufacturing should be done closer to home now, this kind of idea about resilience.
Right.
That could really hit a lot of these economies very hard. And, even the basic model we have in our minds, kind of we imagine a country coming up and getting richer, a lot of it's about this kind of starting at light manufacturing, low skilled labor, factories, and then you move up the chain towards services. Well, that whole manufacturing might get skipped in a lot of the world where we just, all that becomes back to the richest countries. And we do it with robots, we do it with automation, 3D printers and the rest.
Yeah, so those are just really they're getting hit with the whole range of challenges. And what do you expect to see then? Do you think that we're going to see rich countries find a way to step up and meet this demand? Are you optimistic on that, or I'm concerned about it? What do you think?
I see it kind of a vacuum of leadership right now. I think there is a real opportunity. That politics are really scrambled by this situation. And you remember the George W. Bush administration, you were part of it, where, probably the biggest increases in US foreign assistance and major programs like PEPFAR, MCC, President's Malaria Initiative were all launched under a Republican and their conservative administration, which is really unusual. And maybe this is a chance to kind of put partisanship aside and say it's a crisis. We need something different. We should think of global health as a security issue, and not just a humanitarian one. And maybe you put together a really big package. But we had Chris Coons interviewed in Devex in Devex today, and he was talking about a $12 billion package he was trying to put forward, and he hasn't gotten a lot of traction on it.
Yeah.
So I feel like there's a lack of leadership right now. I'd love to hear more from the UN Secretary General, from religious and cultural leaders around the world. A little less of the just kind of stay home and social distance where you live in your community, a little more of, hey, what are we doing for the least among us? What are we doing for the most fully impacted, the most vulnerable communities in the world? Yeah,
there is a lot of education that has to happen there. I saw the interview with Senator Coons. It was terrific, and he's spot on, and would love to find ways to try to support his effort on that. And you're right, there is no reason why this administration should not be on board with that, and would put us in a good leadership position to encourage others to step up as well. And it would go a long way.
Yeah. I think so.
Yeah, definitely. So there's my next effort is go help Chris.
You're always looking for that next effort.
We will help him. We'll do what we can, and I'd love to get him on HPS Insight at some point too, to talk about it. He's so knowledgeable and passionate about these issues. And
we're very lucky to have him in the Senate and leading on these issues. Absolutely.
Yeah. Raj, what else is new? You have a book coming?
So my book is out. The paperback just came out a week ago. The Business of Changing the World. It's out. Yeah, The Business of Changing the World, it's called, and it's basically the argument I'm making is, after spending 20 years now covering this space and thinking about these issues, that we talk about every other industry going through a disruption from technology and big money, and that charity and philanthropy and foreign aid, it's all going through the same disruption right now. Maybe a little later than other industries, but it's happening. And a lot of it's the billionaire money that's coming into this space. A lot of it's the new technology and new approaches. But I document that in a book that tries to kind of talk through what might this really mean. And my argument is charity has been around for millennia. It's like since the dawn of human civilization, we've had most people living in extreme poverty, and this idea of helping the poor, and that we are turning that on its head now in 2020. It's a moment of a totally different way of thinking, which is not about just generosity and helping. It's which tends to be more about us, the givers, and it's much more now about a competition for really good results. So it's not just sort of good intentions, but good results that matter more than ever. And I think it's a really interesting moment. And this pandemic is cropping up in a way at a moment where we could hopefully advance that discussion about what does the future of philanthropy and aid actually look like? What do we need it to look like to solve some of the big challenges in the world?
Well, I do encourage everyone to go out and read it. It's called The Business of Changing the World. Raj, one of the smartest people, my favorite people to talk to on these issues. And I appreciate you making time for us today, and I hope we can get you back on.
Oh, anytime. I love talking to you, Tony, and I really appreciate that. And yeah, one of these days, even in person.
It'd be great to do it in person. I have a big hug for you when we're allowed to do that again.
When we're allowed to do it, yeah.
All right, my friend, take care. Thanks for joining us on HPS Insight.
Thank you for listening to the HPS Insights podcast, produced by Hamilton Place Strategies. For the latest updates, follow us on Twitter at HPS Insight and visit us on the web at hamiltonplacestrategies.com.